या देवी सर्वभूतेषु शक्तिरूपेण संस्थिता नमस्तस्यै 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 नमो नमः हरि ओम Namaste, Sat Shri Akal, Adab, good morning to all. I would like to introduce myself. I am Dr. Jasmine, Assistant Professor in Kumar Bhatia Department, Shri Babu Singh Jaising Ayurvedic Medical College and Hospital, Farrukhabad, UP. So it's a moment of great pleasure to welcome our Honorable Chairman Sir, Director Madam, Principal Sir, our renowned guest speakers and delegates in Bala Jeevanam 2023. Of our eminent guest speakers, Sorry for the interruption. There were some technical issues. It's a moment of great pleasure to welcome our Honorable Chairman, Sir, Director, Madam, Principal, Sir, our renowned guest speakers and delegate in Bala Jeevanam 2023, a national webinar on the occasion of World Breastfeeding Week, organizing by our Kumar Vidya Department, Shri Babu Singh Jaising Ayurvedic Medical College and Hospital, Farrukhabad, UP. And a special welcome of our eminent speakers for graciously accepting our invitation and giving us their precious time to share their knowledge on this commencement day. We are honored to have you, sir, ma'am. Thank you. As we all know, Almighty Dhanvantari is a god of medicine and avatar of Lord Vishnu. So it's impossible to start this webinar without taking their blessings. So for this, I would like to request our principal, sir, Dr. G.K. Srinivas, sir, and our HOD ma'am, Dr. Pushpit Bala Jeevanam ma'am, to come forward to lighten the lamp. And I also request to all of you to join us. May Lord Dhanvantari showers infinite wealth in the form of health on us. I feel great proud to say that this is our second webinar, organizing by obviously our Kumar Vidya Department, Shri Babu Singh Jaising Ayurvedic Medical College and Hospital, Farrukhabad. Our college is the best college in UP, approved by NCSM, affiliated to Mahayogi Guru Gorakhnath Ayush University, Gorakhpur, Uttar Pradesh. JS Group of Institutions is the outcome of a frame of its founder, Shri Babu Singh and Shri Jai Singh, 8 decades ago, who had the vision to provide quality healthcare to the citizens of all over the India. As we all know, World Breastfeeding is celebrated every year on the first week of August. It is a global campaign to raise awareness and to galvanize action on themes related to breastfeeding. Now, I would like to request respected Dr. G.K. Srinivas sir for keynote address.
Om Shri Vigneshavaya Namaha. Om Shri Gurubhyo Namaha. Good morning, everybody. Sarve Janaah Sukhino Bhavantu. radio vigilance or is going to really morning, everybody. I welcome you all on the behalf of the Babu Singh Jai Singh Rajgir Medical College, Farakabad. Respected all the dignitaries and today's dignified speakers who are from all the corners of India and students and my dear colleagues. Today, as we all know, World Breastfeeding Week we are celebrating. So it's a great honor and privilege for us to educate the society regarding the breastfeeding. As you all know, this breastfeed is considered as the best feed, and species milk is specific milk to the baby. Nothing can be replaced. Nothing can be replaced apart from the breast milk. So that's why our Acharya Kashyapa has beautifully explained that Kshiram Satvim Hi Balanam, Kshiram Jeevanamuchyate, Kshiram Pushtikaram, Vruddhikaram, Balavivartanam. So this is maybe 5,000-10,000 years back. The shloka has quoted by our Acharya Kashyapa. It means during that olden days itself, the predominance and the benefit of breast milk was known by our acharyas, and very beautifully they told, Kshiram Sakvim. See, apart from breast milk, nothing can be replaced. Even if you go for any tin food, lactogen, etc., that cannot be replaced with the breast milk. And as well as Kshiram, Pushtikaram, Vruddhikaram, definitely in the growth and development of a child, breast milk plays a very, very important, because it's not only concerned with the physical growth, it also concerned with the emotional bonding. Here, two things plays a very, very important role in breastfeeding. That is the benefit to the mother and the benefit to the baby. As far as the mother is concerned, so obviously will be evolution of the uterus due to oxytocin secretion, and for the baby, immunological point of view, immunoglobulins through cholesterol and emotional bonding, and a lot of benefits are there. So these benefits, our dignified speakers will going to present in their talk. And as far as you know, the World Breastfeeding Week is started in the year of 1992 by WABA. WABA is nothing but World Alliance for Breastfeeding Activity. The main intention of WABA is to create awareness in the community regarding breastfeeding, because breastfeeding is usually stopped by the people, by the mothers, because of uh, like couple of reasons. That is one for cosmetic purpose, and another for due to malnutrition, or another for due to any disease. So lack of awareness makes them to stop the breastfeeding abruptly. And nowadays, the burning issue, the theme of uh, this year, breastfeeding week is enabling breastfeeding, making difference for working parents, especially working parents in the working environment. So where they cannot able to feed their baby, and due to their working burden, they used to stop breastfeeding very early. So because of this, the baby will be deprived, and the deprived baby will be prone for more disease. So that is the concern. So that's why this year we have made a resolution that even the working women should be provided a feeding room, and she should be taught the regarding the importance of feeding, and the breastfeeding should be established, should be continued at least for 2 years. So we told exclusive breastfeeding for 6 months, but WHO has advised up to 2 years. 2 years is considered the best time, so that the baby will get all the nutrients which is required for its growth and development. So in this occasion, I would like to thank our chairman sir, our chairman madam for providing a beautiful platform through this Bala Jeevanam. So this is the second consecutive year we are launching this webinar program, and I wish all the participants who are from all the corner of the nation participate actively, get benefited with the experience and knowledge of speakers, and make this session a grand success. With this, I wish our team and our colleagues for the success of today's webinar. Thank you. Thank you.
Thank you, sir, for addressing the note and telling us about the importance of breastfeeding and history of WABA. Before starting the webinar, I would like to share today's program schedule with you. After this inaugural session, we will begin our scientific session, for which we have 4 eminent speakers with us. We will be having 2 lectures before lunch and 2 post-lunch. There will be interactive session after every lecture where you can put your queries in the chat box. After scientific session, we will conclude our webinar with valedictory session. All the faculty of Kumar Bhitya, Bal Jeevana team are very thankful to our Honorable Chairman Sir, Dr. Shailendra Yadav Sir, our respected Director Madam, Dr. Sunita Yadav Madam, to appreciate and motivate us always, and for organizing different events like this in the field of Ayurveda. And that's me at the end of my talk. Thanks to respected Principal Sir, Managing Committee, Kumar Bhitya Department for giving me this opportunity to start this webinar. Now I would like to hand over to Dr. Akanksha, Assistant Professor of Kumar Bhitya Department, to continue with scientific session. Thank you. Namaste.
Good morning, everyone, and namaste. So I would like to invite our first guest speaker, that is Dr. Maitri ma'am. She has done her BMS from Shri Shri Naru Singh Nath Ayurveda College and Research Institute, Odisha. And she has done MD from SDM Shri Dharmasthala Manjunatheshwara College of Ayurveda and Hospital, Hassan. And she secured 3rd rank in the MD IU examination for the whole state of Karnataka. And she has published 5 articles in renowned journal, and she is an authorized DASU tester. So I would like to invite Dr. Maitri ma'am, and I would like her to share her knowledge. Please, ma'am, proceed.
Thank you so much, Akanksha. First of all, I would like to thank the administration of Sri Babu Singh Jaising Ayurveda College, Ayurveda Medical College, for giving me this opportunity. And thanks a lot to the organizing committee for giving me this opportunity. Please enable me for sharing the screen.
Madam, you can share from your side, madam. Permission given.
Host disable participant screen sharing. It is, the screen is like a. Or else you make me the host so that I can share my screen.
Madam, you can share.
Here it is written that host disable participants screen sharing. When I am trying to share my screen, no, it is written host disable participant screen sharing.
You can start now, madam.
Is it visible?
Visible, madam.
Thank you. So now we will discuss about breastfeeding, a safeguard for mother and the baby. Why it is safe for both mother and baby, how much it is beneficial for the mother as well as the baby, and how much it is important. So the contents will be the normal introduction, breastfeeding, and what Ayurveda tells about the breastfeeding and its importance. Benefits of breastfeeding for the baby, benefits of the breastfeeding for the mother. As now the theme of this breastfeeding week is it is for working mother. So we'll see how can we store the breast milk, how long, at what temperature we can store the breast milk. Next is the contraindication, in which conditions we should not give the breast milk to the child. And last is the conclusion. So as we know, children are the world's most valuable resources. So the nutrition as well as the growth and development of the children are very much essential for nowadays. Proper nutrition is essential for optimal growth and development of children. And the first few months of life, the brain grows at a rapid rate. As we know, 80% of the brain growth happen at the age of 3 years, and 90 mostly or almost the brain development occurs by the age of 5 years. That is 90%. So taking care of the developing brain, giving nutrition to it is very much essential. This is why WHO as well as the American Association of Pediatric, they recommend the breastfeeding till 2 years or in toddler age also. So and breastfeeding is very much essential for improving the bond between the new mother and the baby. Bonding between the mother and the baby is very much necessary for maintenance of the lactation also, and formation of breast milk also. Formation of breast milk and the bonding goes within that. Like if more bonding result in more secretion of the breast milk, and for maintenance of lactation is also the bonding is necessary. In other words, if we go to say mother is doing breastfeeding, automatically the bonding will strengthen, and likewise the lactation will also maintain. Next is the human milk is uniquely suited to the human infants in nutrition and bioactive factors, and promotes survival of healthy infants. As we know, the human milk is called as species specific as well as the baby specific nature of milk. It's secreted as per the need of the baby. In case of term, if the baby is term, in case of term, the quantity of the milk will be suited for a term baby. If the mother has delivered a preterm baby, the quality of the milk secreted from the mother is suited for the preterm baby. Likewise, species specific. It means human milk only suited for the human child. And in case of preterm also, the quality of breast milk will be suited for the nutrition, growth and development of the preterm. As much as she or he require the vitamin, the bioactive factors, the nutrition, that much will be secreted through the breast milk. Breastfeeding and Ayurveda. Now we'll see what all the reference we get from Ayurveda, from Kashyapa Samhita, from Charak Samhita, from Sushruta Samhita about the breastfeeding and its importance. So first I will quote the shloka of Kashyapa Sutrasthan. Avyahata balanga ayu arogo vardhate sukham shishur dhatri anapatya suddha kshirasya lakshanam. It means avyahata, bala, anger and ayu. Avyahata means unobstructed. Okay, unobstructed and easy growth. Bala means strength. Anga means proper growth and development of different body parts. And ayu means longevity. Unobstructed, these all things. It means unobstructed longevity means obviously it will give a better immunity to the child. And then aroga means free from any diseases. So it will refer to the better immunity. Vardhate sukham. It can be correlated with better growth and development of the child. Okay, so it means the breast milk, what the mother is feeding, it's rich in nutrients. So the growth and development of the baby will be perfect for in breastfeeded baby. Next line, Shishur Dhatri Anapatyo Suddha Kshirasya Lakshana. It means if a mother or the nursing mother is feeding with breast milk to her child, it won't cause any pain to the mother as well as to the baby. It means the mother and baby both will be healthy by the process of breastfeeding. This is the and Acharya Kashyapa has told this is the quality of Suddha Kshira. We can take here he has described both the importance and the benefits of breastfeeding. Next, if we see in Charaka Sutrasthan 25th chapter, in Agriya Dravya Adhyaya, Acharya Charaka has told Shira Jivaniyana. It means in all the Jivaniya Dravya, we know Shira is the best among all the Jivaniya Dravya. It means it is the best for the maintenance of health as well as the longevity. Next, in Charaka, while describing there he has mentioned, I have only quoted the shloka which is showing the importance of breast milk. Okay, so there he has said Tat Pushtikaram Arogyakaram Cheti. It means the breast milk which is secreted from the mother is Pushtikara. It means it is very rich in nutrients. Arogyakaram. It means it will build the immunity in such a way that the baby will be free from all the diseases. This is the benefit of breast milk. Next, in Sushruta Sarirsthan also, while describing the same Stanya Sampat, Acharya Sushruta has after describing the quality of breast milk, last line he has described about the importance. We can take it as the importance of breast milk. That is Kumarasya Arogyam Sariro Upachayo Vala Bruddhischa Vabanti. It means if the baby is fed with the breast milk, Kumarasya Arogyam, that is the baby will be free from all the diseases. The immunity will be improved by the breast milk. And Sariro Upachayam, it means proper growth and development of the baby by getting the good nutrition from the breast milk. As we know, it is a dynamic state of milk. It will have all the nutrients which is needed for a baby. So Sariro Pachayam, proper growth and development of the baby. Then Bala Bruddhischa Bhavanti. Here Bala Bruddhi means we can take it as in two ways. Maybe Sharira Bala and Vyadhi Bala. Okay. So Sharira Bala Bruddhi means good strength, good growth and development, improvement in the strength of the baby. And next is immune system, the matured immune system, or with breastfeeding, the immune system will be good, so that the baby can protect himself or herself from various diseases. Next, these are few references from Ayurveda which I have collected, which shows the benefits or the importance of breast milk. Why a mother should fed with breast milk. So now we will move towards the benefits to the baby. Why and how come the breast milk is beneficial for the baby? So breast milk provides an ideal nutrition. Okay, for infants, for the toddlers, breast milk provides the ideal nutrition for infants. It has a nearly perfect mix of vitamin, protein, fats, the bioactive factors, the immunological factors, which all are very much essential for the proper growth of the baby. Okay. Next, it is provided in a very more easily digested form. As we know, the breast milk is less in protein casein, which is very much easy, which make the milk softer to digest. So it is also helpful in gut maturation. The breast milk helps in the gut maturation of the newborn. Hence, there are very less chances of constipation, diarrhea, stomach upset, and the bowel movement will be clear after the gut maturation. Next is, it contains various antibodies. Breast milk contains various antibodies like lactoferrin, lactoalbumin, IgG, IgA, etc., which helps the baby to fight against various infections. Last is, breastfed baby gains right amount of weight rather than the formula-fed baby. We can straightly say that the baby, one who is breastfed and another one is with formula fed. The breastfed baby likely to gain the right amount of weight as per their age. Next, we'll see about the nutritional factor in the breast milk. Grossly, we'll see about the composition here. Okay, the breast milk and its nutritional value. So breast milk contains mostly 3.5 grams of fat in 100 ml of breast milk. Breast milk, the fat contains this long chain polyunsaturated fatty acids. They are not available in any other milk. In formula milk also, this long chain polyunsaturated fatty acid is not available. So those are the fat present in the breast milk are palmic acid and oleic acid. These fatty acids are more responsible for the neurological development of the baby. So it is very much essential for the neurological development, the brain growth of the baby. Next, if we see lactose, the main source of carbohydrate. Lactose is 7 gram in 100 ml of breast milk, which is more than other milk, right? So lactose, 7 gram of lactose in 100 ml of milk is more in mother's breast milk rather than the formula milk. So it is very much essential for the growth and development. Lactose is another source, important source for energy, and it is very much essential for the development of the cerebrocytes, right? So if the carbohydrate are responsible for the maintain the growth of cerebrocyte, which will promote the healthier brain growth. Okay. Thirdly, the protein milk, mature milk. This all composition are for mature milk. So mature milk contains 0.4 gram of, this 0.4 gram is for protein casein. So 0.4 gram of protein casein, it forms much softer and much easily digested. The protein casein, the less amount of protein casein is beneficial because it forms the milk easy to digest. Next, breast milk prevents the shortage of vitamin A between 12 to 36 months, which is very much essential in the toddler age group. Then, breast milk decreases the risk of vitamin A and iron deficiency anemia. But breast milk provides adequate water for hydration when if we are staying in a contaminated zone, or we are staying where the water resources is water resources is not proper, then the breast milk is very much essential for the hydration of the baby. Next, detailing we will see which are proteins are present in the breast milk and what are their functions. So earlier I have told that main protein is casein protein and whey protein. Two main type of protein present in the breast milk. That is 60% of whey protein and 40% of protein casein. That is 0.4%. And rather than that, it contains lactoferrin, which inhibits the growth of iron-dependent bacteria in GI tract. Before only I have told breast milk improves the, in previous slide it has told, breast milk decreases the risk of iron deficiency anemia. Here we have the reference, it inhibits the growth of iron-dependent bacteria in GIT. As iron-dependent bacteria, growth of iron-dependent bacteria will reduce in the GIT, the iron load and iron supplement will be increased. Then next is secretory IgA, IgG and IgM. It helps to protect the infant against microbes, especially those which the mom and family are exposed to. It means the secretory IgG and IgA will reduce mainly the nosocomial infection or the infection spread through excessive handling. That is only told, those microbes which is transferred from the mother and the family, they are exposed to. So it may reduce the chances of the nosocomial infection and the infection spread through excessive handling. Am I audible? Is it clear? Am I audible? Okay, thank you. Next is the lysozyme protein. It protects against the Escherichia coli and Salmonella and has anti-inflammatory function in the gut. Next is the bifidus factor, which supports the growth of lactobacillus and it creates. Thank you. It creates an acidic movement and it inhibits the growth of harmful bacteria, as well as lactobacillus will help in the gut maturation and clearing the bowel throughout in the infant period. Next are the fats and vitamin. As I have told, it includes the breast milk includes polyunsaturated long chain fatty acid, which is essential for the neurological and brain development, retinal power and proper nervous system development. Those are palmic acid and palmitic acid and oleic acid. Two types of fats are present in the breast milk. If we see the contents of vitamin, the contents of an amount of vitamin is in breast milk. It depends on mother, how much the mother is, the intake of food by the mother. And if we see the level of vitamin is very much stable throughout the day in the breast milk, but it depends, maintenance of those vitamins depends on the mother intake of food. Next is the carbohydrate. The primary source of compounds of carbohydrate is lactose. As we know, it is the very much essential for maintenance of the energy of the baby or the child. It helps to reduce the amount of unhealthy bacteria present in the GI tract, improves the absorption of calcium, phosphorus, and magnesium like electrolytes. So the baby will maintain the fluid as well as the electrolytes in his life. Then it promotes the growth of healthy bacteria. And previously I have said that carbohydrates will maintain the number of cerebrocytes. It will help to increase the number of cerebrocytes, maintain the growth of cerebrocytes, which will promote the healthy. Now, a recent research has shown that a newly discovered protein complex present in the breast milk is Hamlet complex. Okay, so research shows that it is formed from the alpha-lactalbumin when it is bind with the oleic acid. Okay, when the lactalbumin binds with the fat oleic acid, it forms the Hamlet compound. We'll see the advantages of this. This is lethal to tumor cells. It will prevent causing of tumor. It increases the bacteria's sensitivity to different classes of antibiotics. It will increase the bacteria's sensitivity to different classes of antibiotics. Means if we are administering any antibiotics, it will increases its absorption. So here it is a formula of alpha-lactalbumin plus the oleic acid part will gives rise to the compound protein complex compound, that is Hamlet compound, which is very much essential for the maintenance of health and prevention of tumor cells and such things. Next, we will see what till now we have seen the importance or the nutritional factors of the breast milk. Now we will see how much it is important, what all things it prevents. Right. So first, breastfeeding lowers the risk of having asthma and various allergies. As the antibodies present in the breast milk develop the immune system against various allergies. So breast milk, if the baby is fed with the breast milk rather than the formula fed, there will be less chances of asthma, allergies like atopic dermatitis and all. Okay. Next is there is evidence that if the baby is breastfeeding for at least 4 months compared to the formula fed. One baby is in breastfeeding for 4 months, another is with formula fed for 4 months. It will prevent the occurrence of atopic dermatitis, cow milk, allergy, and wheezing in early childhood. If we compare the baby, rather than one baby is with formula fed and another is with breast milk feeding. So there are in the breast milk feeding wala baby, there will be very less chances of atopic dermatitis, cow milk allergy, wheezing in early childhood. And then SIDS is sudden infant death syndrome. According to American Academy of Pediatrics, breastfeeding plays a very important role in sudden infant death syndrome. Next is, as I have told, the breast milk will help in the maturation of gut. So there are very less chances of diarrhea. Babies who are in exclusive breastfeeding for 6 months without any formula feed have fewer chances of ear infection, respiratory tract infection. There are very less chances of diarrhea. And also the research shows that breast milk lower the risk of diabetes, obesity, and certain cancers like acute leukemia, which is very much common in children. Acute leukemia, lymphoma, etc. These all are prevented through breast milk. So now we'll see that system-wise what all benefits we get from the breast milk. In eyes, if we see the visual acuity is higher in babies who are fed with the human milk. In ears, I have told before, breastfed babies get the fewer ear infection. In throat, children who are breastfed are less likely to require tonsillectomy. They have less infection, so that not required of tonsillectomy. Higher IQ, the cholesterol and other type of fat in human milk is very much essential for the growth of nervous system and nerve tissue. So IQ will be higher in case of breastfeeded children. Then endocrine system, it reduces the risk of diabetes. In case of mouth, what benefit? Less need for orthodontics in children breastfed more than 1 year. Improve the muscle of the face from sucking at the breast. Subtle changes in the taste of human milk. Prepare the babies to accept variety of solid food. As they are used to the mother's milk, they will accept the variety of solid food very easily. Then in respiratory system, if we see, breastfed baby have fewer and less severe upper respiratory infection, ear infection, less wheezing, less pneumonia, less number of influenza. Okay, next is urinary tract, fewer infection in for the kidney, as the breast milk is very easier to infiltrate through the kidney. So very less chances of kidney diseases. In appendix, child with acute appendicitis are less likely to have been breastfed than kidneys. Or then urinary tract, fewer infection in breastfed babies. Bowels at the gut maturation is done with the breast milk, so bowels are less constipated. Then joints and muscle, juvenile rheumatoid arthritis is less common in child who were breastfed. Skin, less number of allergy, less number of atopic dermatitis. Then immune system, they respond better to vaccination. Human milk helps the mature immune system and decrease the risk of childhood cancer. As with the breast milk only, with the colostrum only, the baby, since from the first day has had reacted with the immune system or the immunological compounds like IgG, IgM. So the response to vaccination which we are giving after 1.5 months, it will or throughout the life, it will be better response. The baby will shows better response to the vaccination. Then in digestive system, if we see less diarrhea, fewer gastrointestinal infection in babies who are breastfed. 6 months or more exclusively breastfeeding reduces the risk of food allergy also, less risk of Crohn's disease and ulcerative colitis in adulthood. If we see in heart and circulatory system, breastfed children have lower risk of cholesterol as they've grown as adult, and heart rates are lower in breastfed infants. These are the gross system-wise importance of the breastfeeding. We'll see infants. We'll see now what are the importance of breastfeeding in toddlers. Okay, in brain, if we see higher intellectual and cognitive aptitude compared to the formula-fed babies of their peers. If we see the same age group, two toddlers of same age group, the breastfed toddler will have higher intellectual and cognitive aptitude. Then ears, as they have less number of ear infection during their infancy, so breastfed toddler have better hearing due to lower incidence of ear infection. Next, if we see in the eyes, as their eyes is similar to brain in regards of nervous tissue, breastfed toddler have stronger visual acuity. Also, at 12 months, 448 ml of breast milk provides 75% of toddlers' vitamin A requirement, and vitamin A is needed for the retina of the eye, and it is very necessary for both the low light and color vision. As I have told before only, that it prevents the vitamin A deprivation during 12 to 36 months of age. So if the toddler is fed with the breast milk, she will get the nutrition of vitamin A and less chances of eye problem. Next is teeth. Thumb sucking is very less likely to occur in breastfed toddler, so the teeth are less likely to become misaligned. Also, increase the duration of nursing actually improves the dental arch. And next we'll see weight. How much the weight gain is there. So toddlers who are breastfed for extended period of time tends to have leaner body with less risk of obesity. Nowadays, obesity is very much common due to more formula feeding. Now, mother is working or somewhere she is working, she is unable to breastfeed. It is a easier way. Now it is everybody is thinking that it is a easier way to start with the formula feed, but they should know the benefits and what all things are there if a baby is breastfed. Next, if we see the skin, it is smoother and shinier if the baby is breastfeeding. Hair, breastfed toddlers have glossier, healthier hair. Protein is the major function and structural compound of hair cells, and it is essential for growth and repair. After 12 months, if we see the 448 ml of breast milk provides 45% of toddlers' protein requirements. Rather than that, if he or she is a toddler, along with breast milk, we are giving solid foods also. In that also, we are giving dal and all proteins. So in breast milk only, she or he is getting 45% of his or her protein requirement, which is very much essential for the hair health. Next is test bud. If the breastfed toddler are less likely to be fuzzy eater, however, even if they go through a fuzzy period, breastfed toddlers still get their taste buds stimulated by their range of flavors in the mommy's milk. Next is bone system. The calcium is a mineral that strengthens the bones after 12 months. That is 448 ml of milk in breast milk provides 36% of toddler's calcium requirement, which is in the most natural form and easily digested and absorbed. So the bone health is very much good in breastfed babies. At 1 year of age, a child immune system functioning at 60% of adult level. When the baby crosses 1 year, the immune system works as the adult. 60% of the immune system works as the adulthood, right? So the antibodies in the breast milk continues to provide valuable protection during the toddler period. In fact, the immunological benefits of the breastfeeding actually increase during the 2nd and 3rd year of nursing. If the baby is nursed for 3rd and 4th year in toddler age group, the immunological factors which are present in the infancy period in the breast milk, it will increase. And I have told you, the breast milk is baby specific as well as species specific. So baby specific, when the baby is nursed after 2 to 3 years, there are more chances of infection as the baby is exposed to the external infection. So in that case, the breast milk will provide that much. It will increase. The immunological benefits of breastfeeding increases after 2nd and 3rd year. These all are the benefits of breastfeeding in toddler. Next, we'll see the benefits to the mother. Breastfeeding does not only have the benefits toward the child only, it has benefits to the mother and to the child both. So now we'll see the benefits of breastfeeding to the mother. That's why I have told it is a safeguard for mother as well as the baby. So breastfeeding burns extra calories, so it can help to lose the pregnancy weight faster. Mother has gained some weight during pregnancy, no? So breastfeeding burns extra calories, which help the mother to burn the extra calories and lose the pregnancy weight. As well as when during the lactational period, our main hormone for lactation is prolactin and oxytocin. So oxytocin is secreted during the lactation, during the period of lactation. When the baby suckles as the breast, the oxytocin reflects, right? So oxytocin is secreted, and the oxytocin helps the uterus to go back to its pre-pregnancy size. So oxytocin helps the uterus to return the pre-pregnancy size and may reduce the uterine bleeding after birth. Okay. And third, most importantly, the bonding between the mother and the baby increases. Third is, women who is breastfeed their infant has less chances of anxiety and more maturity rather than the bottle-fed mother. Okay, if the mother is feeding with a bottle or formula fed to the baby, compared to them, the breastfed mothers have less chances of anxiety and they show more maturity. Then breastfeeding soon after birth provide the protection against the pregnancy due to lactational amenorrhea. Then we'll see the health benefits, which all disease can be prevented through breastfeeding. If the mother is breastfeeding, she has very less or very lower chances of ovarian cancer, breast cancer, as well as osteoporosis. If long duration of lactation was associated with reduced risk of congenital coronary heart disease, long-term breastfeeding was associated with significant reduction in the risk of rheumatoid arthritis. These all health benefits are there in breastfeeding. If the mother is breastfeeding for a longer period of time, so always WHO and AAP has told exclusive breastfeeding till 6 months and extended up to, it can be extended up to 2 years. 2 years is normal. So if the mother is breastfeeding till 2 years, she has a very less chances of breast cancer, ovarian cancer, less chances of osteoporosis, rheumatoid arthritis, as well as coronary heart diseases. Here we'll see a statistical data, the benefits of breastfeeding. If a infant or children is in breastfeeding, is fed with the breast milk, there are 36% of reduced risk of gastrointestinal infection and diarrhea in the first years. Then 72% less chances of 72% reduced risk of respiratory tract infection in the first year, reduced risk of sudden infant death syndrome, that is 36% reduction in the risk of sudden infant death syndrome. In 15 to 30% of the baby, reduction in the obesity, as I told, it prevents obesity. Next, 23% reduction in the incidence of middle ear infection in a baby who are breastfed. In mother, if we see, there are 28% of less chances or decrease the risk of breast cancer, 26% less likely to develop the diabetes, 21% reduce the risk of ovarian cancer, and 10% less likely to develop cardiovascular disease. Then 30% reduction in the evidence of diabetes. Now we'll see how breastfeeding is helpful in case of emergencies. Okay, so if we are in any emergency condition, like there are no supply of food, water, anything, some in lockdown all only you can see emergency conditions like. So in emergency conditions, breastfeeding prevents dehydration of infants where there is no access to clean water. If we have stuck in some area where we can't get clean water, so in condition like that, breastfeeding prevents the dehydration for infants where there are no access to clean water. It helps to protect against respiratory diseases and diarrhea in crowded environment. As I have told, it reduces the risk of nosocomial infection or infection spreaded through excessive handling, or the infection spread through the mother and the external environment. So it will helps to protect against the respiratory disease and diarrhea in crowded environment. It helps to prevent hypothermia when baby's temperature drops. As we know, in case of hypothermia also, we prescribe kangaroo mother care, that is skin to skin contact with the mother and the baby. So when a baby is nursed or breastfed, and if we see the sign of good attachment or lactation, good attachment, it has told that the abdomen of mother and baby should be touched. So it helps to prevent hypothermia when baby's temperature drops, and it is readily available anywhere, anytime. Then how long we should breastfeed? How long a baby should be breastfed? This is a more important thing the newly mother should know. We should avoid them of these all things, so that the baby will get the nutrition properly. The baby will prevent the hypoglycemia or prevent the lack of fluid load. So the newborn should nurse for 5 to 10 minutes per breast every 2 hours. It comes in around a day, it will come for 10 to 12 feedings. Okay, so 10 to 12 feedings per day, or it should be nursed for 5 to 10 minutes per breast every hour. In the beginning, for 4 to 5 days, as we know, colostrum is secreted, right? The first breast milk, that is colostrum, is secreted for first 4 to 5 days, and it is very less in quantity. So, for first few months or first few days, the nurse should be frequent and short duration. So we told exclusive breastfeeding every 2 hours. Next, when the infant becomes 1 month or more. After 1 month, how much time we should nurse? After 1 month, as the baby get older, stomach also get larger. So 20 to 40 minutes per breast every 3 to 4 hours. Okay, so 20 to 40 minutes in each breast, or every 3 hours, the baby should be nursed. By 6 months, when the baby reaches 6 months, we should feed the baby 20 to 40 minutes per breast, 3 to 5 times a day. By this time, we can start with the fruit juice and all. So the duration of feeding is more, but the frequency is lesser. Okay. Next, the most important thing is the storage of the breast milk. Right. As this breastfeeding The theme of the breastfeeding week is enable breastfeeding and making difference for working women. So for a working woman, they have some ideas like हम कहीं work कर रहे हैं, we can't breastfeed there, या फिर बच्चे को घर पे छोड़ के जाना पड़ता है, तो they feel a guilt कि हमारा breast milk secretion तो हो रहा है, but we can't feed the breast milk. We should encourage them. We should taught them कि you can express the breast milk and store it for throughout the day. They can use this by storing it. So here is the in which place they should store and at what temperature and the maximum storage time. Okay. So in in a room which is having 25 degrees Celsius or 77 degree Fahrenheit, the maximum storage of breast milk time is 6 to 8 hours. If it is a cold weather, the room temperature is 25 degrees Celsius, आराम से the breast milk can store for 6 to 8 hours. Next, a insulated thermal bag with ice pack. If the ice pack is with the insulated bag is there, the breast milk can be stored up to 24 hours. In a refrigerator, which maintains the temperature of 4 degrees Celsius and 39 degree Fahrenheit, the breast milk can be stored up to 5 days. In freezer compartment inside a refrigerator, if the freezer compartment is inside the refrigerator, the small wala fridge comes in that it is maintaining minus 15 degrees Celsius temperature or 5 degree Fahrenheit, the breast milk can be stored for 2 weeks. Okay, a combined refrigerator and freezer with separate door. If the door of the freezer is separate and refrigerator is separate, and it maintains the temperature of minus 18 degrees Celsius, 0 degree Fahrenheit, there the breast milk can be stored for 3 to 6 months. And then lastly, in a manual defrost deep freezer, where the temperature is maintained for 20 degrees Celsius and minus 4 degree Fahrenheit, there breast milk can be stored for 6 to 12 months. If these all the deep freezer and refrigerator, these all techniques are used in the breast milk banking. Breast milk banking में भी donors से breast milk collect करते हैं और freezer में उसको freeze करके रखते हैं storage के लिए. So we can taught the newly mother these all ideas of storing, expressing the breast milk, storing the breast milk for further use for their infants. Here are some contraindications where we should not give breast milk to the baby. If the mother's condition, if the mother is infected with HIV or AIDS, human T lymphotropic virus 1 and 2, if mother is taking some medication which can harm the baby in that condition, then mother is under chemotherapy, radiation therapy, especially on the chest, and untreated active tuberculosis. If mother is taking cocaine, marijuana, heroin, narcotic drugs, in those cases, mother should not fed the baby with her breast milk. In some contraindication in case of baby with galactosemia, that is primary lactose intolerance, then intestinal obstruction, then congenital abnormalities like cleft lip and cleft palate. In those cases, if we fed with the breast milk or if the baby suckles, then there are many chances of aspiration, right? Then lastly, in perforated anus. In those cases, baby should not fed with the breast milk. So we are coming closer to the last of this scientific session. So conclusion, the breast milk changes constantly to meet the baby's need. As I have told, it is baby specific. The milk changes in volume and composition according to the time of day and nursing frequency and age of the baby to promote healthy growth. Always ready and good for environment. It is available wherever and whenever the baby needs it, always in a right temperature and free from contamination, free of cost. Breastfeeding has no waste, so it is good for environment also. So it is beneficial for the baby, the mother, our earth, the environment, everything, right? Then take home message, what I can suggest, what from this PPT, what I can suggest, the American Association of Pediatrics and WHO recommends exclusive breastfeeding for first 6 months of life and continuous breastfeeding for at least 12 months of life. And as we know, breastfed infants are healthy infants, as breastfeeding is the nectar to the child. And breastfeeding remains the simplest, healthiest, and cost-effective feeding method that fulfills infant nutritional needs. So water fills the stomach, but breastfeeding fills the soul of the baby. Breastfeeding is a mother gift to herself, her baby, as well as the mother earth. Lastly, the facts. What are the facts we can say about breastfeeding? If 90% of families exclusively breastfed for 6 months, then 1,000 less infant death per year and 13 billion rupees can be saved, as it is very cost effective and environment friendly. So 200 to 500 calories used per day during breastfeeding. So no need to go for gym for nursing mother, right? It equals to swimming for 30 laps at a pool and cycling uphill for 1 hour. So these are some facts about breastfeeding. Thank you so much. This is the end of my presentation. If any queries can be asked.
Thank you, ma'am, for sharing your knowledge with us. Now the session is open for discussion. Is if anyone is having any query, they can ask regarding this topic.
Open the chat box and see the questions.
If anyone is having queries, please put in the chat box. I think no queries are there. Thank you, ma'am, for your valuable time giving to us, what you have given to us. Thanksgiving is a time of togetherness and gratitude. Ma'am has explained about the importance of breast milk for mother and baby in detail. Thank you so much, ma'am, showing your valuable time and knowledge with us. Thank you so much.
There is a question.
One question came, ma'am. Working ladies who don't get 6 months leave after delivery, what all measures they can take to maintain the secretion? The question is, working lady who don't get 6 months leave after delivery, what all measures they can take to maintain the secretion? This answer our principal sir will give, because ma'am is not there because of network connectivity. So sir will give the answer.
Very good question asked. Very now audible. Yes. To maintain the secretion, the only measure is the breastfeeding. Keep on the breastfeeding. It's the only solution. And the second thing is what working women can feed the baby in the morning and as well as when they come back from the work. And another one, as Madam told, the breast milk can be it's a pumped, it can be extracted, and it can be kept in the storage. So when you extract, when you make the baby to suck, definitely the secretions will be on. It will be on. So if you stop continuously feeding the baby, then only the matter will comes the cessation of breast milk. Otherwise, there won't be. The only solution is she has to feed in the morning and when she come back from the work, and during the gap, she has to extract the milk and she can store. By adopting these measures, so definitely there will be establishment or maintenance of secretions of breast milk will be there.
Thank you, sir. So one more question is there. If due to some reason we have to suppress the breast milk, do we have Ayurvedic medicine? If due to some reasons we have to suppress the breast milk, do we have Ayurvedic medicines? For suppression.
Why is nothing? Why? Ask the second speaker to get ready. Hello. The breast milk. Of course, for enhance the breast milk, we can have the
Sanne Shodhana Gana and Sanne Utpatti Gana Charakota that we can give. And Vatsalita is the best thing, and continuous feeding that enhances the breast milk. Suppress is just opposite to that, that by a froth and not having the proper food. Madura not saving by a chinta, so these all lead to the suppress of the breast milk. That's all. Next, our second speaker is joined. Let's begin the session.
So inviting to the next speaker, Dr. Chaitali Samant, ma'am. Good morning, ma'am. Dr. Chaitali Samant is a senior Ayurvedic practitioner, a native of Goa, currently practicing and residing in Bangalore, Karnataka. After completing her BMS in the year 2003 from Gomantak Ayurveda Mahavidyalaya and Research Center, Goa University, Dr. Samant completed MD in Kamar Vritya from the prestigious ITRA Jamnagar, Gujarat University in the year 2006. She has been honored with a gold medal for academic excellence during her postgraduate studies. Dr. Chaitali has been practicing Ayurveda for the last 17 years. She has worked for 12 years teaching undergraduate students as a professor and served as a head of department of Kamar Vritya till year 2022. She has been a member board of studies in clinical Ayurveda medicine for Goa University. She currently practices at her own clinic in Malleshwaram and is a pediatric consultant in Ramaya Indic Specialty Ayurveda Hospital, Bangalore. Good morning. I welcome you, ma'am. Please proceed.
Hello.
Hello.
Hello. Madam, you are unmuted.
Okay.
You can start your speech.
Yeah. Am I audible?
Yes, madam.
Okay. I think the video has not started, is it?
Not started, madam.
Okay. All right. We'll go ahead. I'll start sharing the screen and we'll see. There seems to be some issue with the video. I'll start sharing the presentation. Presentation is visible?
Visible, ma'am.
Yeah, thank you. Okay. So the World Breastfeeding Week has started, and this is an excellent initiative that we are discussing about how we can enable breastfeeding in working parents, especially, which is the theme of this year's Breastfeeding Week. There are several different areas which encompass how we can empower women or working parents to continuously breastfeed their children or infants, at least till they are 6 months of age, for exclusive breastfeeding, and as long as they can breastfeed their children. Some of them are policy related things in
This
which
speaker is
so some of them are policy related
mute that one.
decisions which need to be taken.
Increase the volume.
Some of them are policy related decisions which need to come from their employers. Some of them are changes in the society that we need to encourage women to breastfeed more actively, and so on. Today we will discuss in terms of Ayurveda, what are the challenges related to breastfeeding that we can resolve. So, as most of the authors and most of the speakers today will address, human breast milk or स्तन्य is extremely dynamic. Dynamic how so? It's a functional food. Functional food being any food which can meet or be beneficial for requirements of multiple tissue or organ systems in our body, which will have a very robust kind of a nutrient profile, meet the nutritional requirements, both macro and micro, in the infant who is feeding from that, or in the person who's feeding from that food, also provide additional benefits such as boosting of immune system, antioxidant activity, protection against several diseases, and so on. Breast milk is one of the most important functional foods which is available to us as human beings. And it is dynamic, that is, it carries both nutritional and medicinal values. Ayurveda itself has mentioned usage of breast milk as a medicine, sometimes as anupana, sometimes in the form of nasya, ashtotana, for vranaropana, etc., in multiple conditions, and as well as an ingredient in certain medicines, especially related to Shalakya. And nutritional wise, one of the best foods which is available to the newborn. Of course, it has powerful immunological properties such as maternal IgA and IgG antibodies passed on to the child, which offer lifelong protection for multitude of ailments in the child, be it necrotizing enterocolitis, or be it against protection against childhood asthma, protection against multiple viral ailments, and so on. So there are different benefits to the immunological importance of breast milk. Also, human breast milk has a lifelong impact on the health of the child. For example, exclusively breastfed children are seen to be less prone to developing type 2 diabetes, different kinds of neurodegenerative disorders, as well as their intelligence scores are much higher than those of children who are not exclusively breastfed, and so on. Then the lifelong impact of breast milk is just unparalleled. Economical, it is most economical option for as a nutrition for the newborn and infant, in terms of its cost effectiveness, in terms of low cost in sterilizing it and pasteurizing it. There is no such cost involved, and it is environment friendly, that is, it generates absolutely zero carbon footprint. There are several, if we have to just pinpoint what are the exact benefits of breastfeeding in children, depending on the duration of breastfeeding, then we can see different. For example, exclusive feeding for just 3 months can reduce the risk of type 1 diabetes in children, which is recently increased in the children that we are seeing in clinics, that is the insulin-dependent diabetes or diabetes insipidus, as we call it. That has increased, and exclusive breastfeeding helps to reduce the risk of type 1 diabetes. 40% reduction in type 2 diabetes in infants who are exclusively breastfed as they grow up. As you have seen, especially post the pandemic, the age at which people develop type 2 diabetes or become pre-diabetic has reduced considerably. While earlier it was in late 40s and 50s, now we can see people in their early 30s, late 30s, especially people in their 30s, to be pre-diabetic and sometimes even frankly diabetic. Also, there is a notable difference, as I said earlier, in breastfed infants who are exclusively breastfed for 3 months. And if you extend it, the longer you breastfeed the child exclusively, the higher are the intelligence scores. Then we have exclusive breastfeeding benefits between 4 to 6 months of age. So exclusive feeding up to 6 months is most ideal. That's the minimal that is recommended. In terms of respiratory tract infections, which are one of the most common infections in children owing to their kapha pradhana avastha in terms of their age, the risk of hospitalization for lower respiratory tract infections in first year is almost reduced by 72% if the child is exclusively breastfed for a period of more than 4 months. Also, other childhood respiratory conditions which are chronic, such as or atopic illnesses, which are allergy-borne illnesses such as bronchial asthma, childhood asthma, eczema, or atopic dermatitis, can be reduced almost by 27% in non-risk babies and 42% reduction in babies with family history of these ailments. As you might know, both eczema and asthma have a very strong family history. Especially it skips a generation. That is, if the child is suffering, then the grandparents, we commonly see that might be having a strong history of eczema or asthma in either of the conditions. So breastfeeding helps to reduce this risk in both children who have family history and who don't have family history. Then in celiac disease, which is gluten triggered enteropathy, right? The gluten intolerance, as we call it. Gluten is a protein which is present in wheat, rye, and barley. It can trigger celiac disease, which can cause ulcerations in the colon and frequent diarrhea and chronic diarrhea related conditions. It's a chronic condition and an autoimmune condition. So if a child is breastfed, it reduces the risk of celiac disease by almost 52%, even at the time of gluten exposure. And if a longer duration of breastfeeding is given, it seems to have a continuing positive effect on these children. Then in 6 to 12 months of age, if the child is breastfed for this long, then there is a 4 times less likely to develop pneumonia compared with infants who are exclusively breastfed for 4 to 6 months. Risk reduction of up to 20% for acute lymphocytic leukemia and a 15% decrease in the risk of acute myeloid leukemia, which is very significant. Then 12 plus months, like beyond 1 year of age, if a child is breastfed without giving any other form of milk, then each month of breastfeeding is associated with 4% reduction in the risk of becoming overweight. As we know, childhood obesity is the new pandemic, silent pandemic that we are facing, with a very heightened risk of different kinds of metabolic conditions or metabolic syndrome happening in children as they grow up, and of course continued immune system benefits. Now, what are the certain factors which affect breastfeeding practices in mothers? See, it's not like motherhood is painted to be very sacred and auspicious and very pleasurable by the society to new mothers. Please don't get me wrong, but many a times the society fails to prepare the new mother, especially for the challenges that new motherhood can pose, especially related to breastfeeding. It is definitely not an easy journey, and the disappointment immediately after delivery that, oh my God, I thought that having a baby will be the most pleasurable experience of my life, but I was not aware it will come with so many challenges, can push many women. This is one of the reasons why many women also go through postpartum depression, because they cannot adapt to the stress and to the new lifestyle of being responsible for somebody. This aspect itself can many a times affect the breastfeeding practices that the mother can adapt. So somewhere they need to be prepared for the challenges in a much effective way than what we are doing now, is what I feel. And many different things affect this. For example, maternal age, at what age people decide to have children can largely affect whether they will be able to have successful initiation of breastfeeding or not. Breast milk secretion varies largely depending on age of the mother. Then maternal education, how aware a mother is about the benefits of breastfeeding or what can be done, and how proactively she will take measures to enhance her breastfeeding or seek help if she is not able to initiate it and then continue feeding the child. That matters. Then income matters in terms of if somebody has to return to work immediately, that can reduce the time for which the mother will breastfeed the child. Then socioeconomic status matters. The marital status, whether it is a single mother or there are both parents are present, can also, and family support, whether the woman who has given birth has enough family support or not, can also affect how much she will be able to breastfeed. Working status matters. If she has to return to work, if there is no paid maternity leave which is given to her, she may discontinue breastfeeding much sooner than other mothers. Parity, as in whether she is primipara or a primigravida or it is a second baby, matters, mode of delivery matters. For example, C-section can pose much more risks related to initiation of breastfeeding as compared to the normal vaginal birth and previous experience. If she has positive experience from her previous delivery related to breastfeeding, then second time on, it can be much easier for them. She will know what to do and so on. So breastfeeding doesn't, depend just on the mother's health, mother's age and her health. It depends on many of the other factors, external factors as well, which could be emotional factors, it could be the logistic factors, employment related and so on. Then it's also important when we are trying to solve this issue or trying to contribute significantly to the rate at which, mothers breastfeed. For example, according to the initiative, which is, the World Breastfeeding Trends, the initiative, which is referred to as the WBTI, 97 countries are participating in this initiative to encourage women to breastfeed their children. India ranks 78th on this list in terms of women who breastfeed their children, exclusively breastfeed their children. 55% only feed their children, exclusively for 6 months. And India had set a target that by 2025, exclusive breastfeeding rate in Indian mothers should increase to a 69%. If we have to contribute to this target in terms of being Ayurveda doctors and practitioners and academicians, what can we do? We have to understand the challenges and then see where we can pitch in terms of our expertise. Most of the women, 53%, say they don't produce enough milk. And this is exactly the area where Ayurveda plays such a big role. Many people might be aware that most commonly used medications for initiating and maintaining breast milk supply are Ayurveda medicines such as Vidari Kanda, Shatavari, Methi, etc. Even modern doctors and many of the nursing homes resort to giving Ayurveda-based supplements to encourage breast milk secretion. This is just they are making use of a very small aspect of Ayurveda that can help in improving their breast milk production or helping women who have lactational failure. There is not much more that we can do in this regard. Then the babies didn't seem satisfied on breast milk alone is 31%. We can help in that regard also by assessing the child's issues and understanding the child's health and helping that to improve. Then baby head feeding challenges, which could be also anatomical sometimes. And struggling with breastfeeding technique is another area where we can pitch in. Now, making our society more breastfeeding friendly for working parents. For example, in terms of interpersonal experiences, prior experience, or having had some training in terms of the knowledge or having a positive attitude towards breastfeeding or having the intention that I want to breastfeed my child also matters. In terms of interpersonal in a work environment, the equation that people have with their colleagues, communication with their boss or their work environment about their intention to continue breastfeeding, social support and networks do matter. In terms of organizational, in a place of work, when they return for work after their paid maternity leave, the physical environment matters a lot. That is whether the company will provide a lactational room or not, child care room or not. For example, in airports, we find nowadays, past few years, there are rooms which are placed to help breastfeeding mothers feed their babies. Even in malls and other places, you can find. So a similar thing needs to be there in workplace too. Then professional breastfeeding support in terms of lactational consultants. I'll come to this further down in the presentation. In terms of community relationship between organization, that is child care and work and social support groups, exclusive groups such as Anganwadi workers and groups made by corporates to encourage women to breastfeed, and in public policy, workplace breastfeeding provisions, employee protection, parental leave policies, extending the period of paid maternity leaves, which is 20, if I'm not mistaken, it is 23 or 26 weeks in India. And then, parental leave policies, national breastfeeding promotion, and etc. Now, if we are talking about the working mother's dilemma, in terms of how should she continue breastfeeding when she goes back to work and what are the challenges that she will face. See, a woman should never be made to choose between mother work and other work, like her work as a mother, which is a full-time work, and her other work, which could be her professional life. A mother should never be made to choose between the two. So a working mother's dilemma is like, if we ask how many women were able to exclusively breastfeed because of their urgency or because of their obligation to join back work, as they didn't have paid maternity leave, only 9% women were able to feed their babies to up to 12 to 24 months while being professional women. 0 to 1 month, only 14%. 21% were able to breastfeed their babies for 3 to 6 months. 23% were able to breastfeed their babies to 6 to 12 months, and 33% 1 to 3 months. So if we have to meet that 69% target of that India has set in terms of encouraging women to breastfeed, there is a lot of work which needs to go in this for allowing us to meet that target by helping women solve issues that they face, and the contribution needs to come from the policymaker as well as Ayurveda doctors such as you and me. Now, what are the challenges that women reported? For example, most women reported that the lack of proper nursing facility at workplace was one of the biggest hurdles. The other hurdles could have been anything, right? But if we have to keep it tangible, then lack of proper nursing facility, because there's certain amount of taboo and embarrassment that can happen to try and feed your babies in public. So there has to be a privacy which needs to be provided by the employer. Then unsupportive colleagues, unsupportive boss, lack of time to express breast milk at work comprised of between 16 to 20% of the challenges, which are significant. If the workplace people don't understand or are not sensitive enough to something as crucial as breastfeeding, then it can pose several society challenges in terms of workplace environment for women. And this needs a shift in thought process, a shift in our understanding and our beliefs, set beliefs, in terms of considering breastfeeding women as a handicap or somebody who's non-productive at work. So this kind of mindset also needs to change. Be it maternity period wherein you're breastfeeding your child, or be it pregnancy period. These are not diseases. Pregnancy is not a disease. Postpartum condition when you're breastfeeding your child is not a disease. This is a societal mindset we need to change. Women, after they complete their 45 days of postpartum period, can definitely be contributing members to the household as well as to the society as well as to their workplace. And they are capable enough to take care of their children and take care of their work. So this kind of mindset should not be allowed in workplaces or in your colleagues, and this needs a paradigm shift. Then in terms of breastfeeding experience reported by mother, many people reported that lack of support from family members. So there are a lot of societal problems, especially in Indian society, wherein the family support which needs to be given in terms of emotional, logistic support, support in terms of, in terms of enabling a woman so that she has sufficient time and a stress-free environment postpartum that she can think about feeding her child peacefully. Then lack of support from spouse, balancing family demands and work, pressure from family to introduce formula by constantly insisting that your milk is not sufficient, your baby is not gaining weight, your baby is weak, look at that person's child looks plumper than your baby, and you are not feeding the baby properly, that's why you should feed formula. So this is one complaint I have heard consistently from all the mothers whom I have helped in terms of initiating and maintaining breastfeeding from different states of India. I don't know how this problem percolates our society, but this is one of the most disgusting trends in our country. While on one hand, we are facing an issue with children who are becoming obese, being glorified for their body weight when they are small. and then being demonized and looked down upon and constantly picked on for their heavy weight. So the same children, when they are toddlers and when they are in their school age, are glorified for excess weight, saying that it looks cute on them, and this is how the obesity creeps in, by overfeeding them, making the weight of your child some kind of a prestige issue for the family, and considering an obese baby as a healthy baby. This is also another mindset that needs to change. If the child is close to the 95th percentile of their height and weight in every pediatrician follow-up or whatever follow-up they are doing with the doctors, it doesn't matter whether the baby looks thinner or plumper compared to another child. That child's weight is fine. And this kind of a confidence needs to be given to the parents, and it needs to come from doctors. So this is something, that pressure to introduce formula from family, which needs to be there. Sibling jealousy is another issue which the parents have to deal on their own. So this I will not address. Or the child, older sibling, needs to undergo sufficient amount of counseling and preparation for accepting a sibling in the family. Other challenges are exhaustion, lack of sleep, supply related issues, health issues related to the baby, then depression, postpartum depression, which is there, and early days challenges, that is finding it difficult to adjust to motherhood in the initial days can also pose significant challenge in this. In this, exhaustion, baby issues, supply issues, and depression, 4 out of these can be resolved by taking help from Ayurveda doctors without introducing toxic chemical or habit-forming medicines, be it postpartum depression, or be it exhaustion being felt by the mother, or be it health issues related to the baby, or supply issues. 4 areas out of the 6 challenges can be addressed with Ayurveda. Then in terms of nursing in public, lack of proper feeding place in public is the biggest challenge. 42.5%, you can't feed babies in public. There is no place to pump milk in public. People raise eyebrows, people take offense to women feeding in public, or women themselves feel shy or embarrassed and perceived restrictions depending on their families that they belong to. So these are the challenges that we face. While the challenges at home need help from social workers, the top 6 challenges, 4 out of them can be resolved with Ayurveda. Now, once a woman starts work, there can be certain challenges which are directly correlated to the Stanyadushtikara factors I have described by our Samhitas, because one of the biggest challenges that women face once they resume work is decline in the supply of breast milk and anxiety related to how will I continue breastfeeding my child. The stress related to going back to work can be correlated to a lot of different things. For example, mana sharira santapa, chintana, vega pratighata, and vega udirana, because of the need to leave home and go. Vega pratighata and vega udirana are more common than we think they are. For example, young children are forced to pass stool in the morning before going to nursery also. Nursery students, mind you, are in the age group of 2.5 to 3 years of age. So we, even as parents, kind of encourage our children in Vega Udirana. And then when they go to school, they learn Vega Pratighata. That is holding back their urges and passing stool or urine once they come home because the washrooms are dirty. Or same goes to women also. I mean, probably women who work in corporate, they may not face this issue. But Vega Pratighata, holding back natural urges, and Vega Udirana are one of the 2 most common factors which affect Stanya Dushti. Stanya Dushti can be correlated to a lot of pediatric disorders that we see in infants as clinicians, and as Ayurveda doctors, we can help in analyzing this from a very early stage and help mothers understand how to get over this, what can be done, and we will see it in the following slides as to how we can contribute to it. Then maternal mental health during the entire postnatal period, because we are talking about manasantapa and excess of stress, chintana. Mental health of the mothers doesn't get much attention in India. For example, the mandatory screening for postpartum depression, which needs to be done on the 10th day post-delivery, first month follow-up, is missing in most of the areas, especially in urban setups. We see widespread prevalence of maternal mental health and emotional well-being related issues post-delivery. For example, 1 in 5 women develop a mental health condition during pregnancy and first year after their baby. 9 out of 10 people with mental health problems, they experience stigma over here. They are not allowed to express it, and it's not very easy for people to accept and express that they have emotional well-being related issues. Then it could be low mood to anxiety, depression, or even frank psychosis. That whole range can be seen in postpartum patients. And difficulty in breastfeeding can have an impact on some women's mental health and confidence, because they may be branded, oh, you had lactational failure, you are a less mother, you didn't care enough for your child, or there is something wrong. Everybody here will agree, especially those people who live in families and who have had experience with childbirth. Anything is wrong with the child, Indian society has a habit of blaming it on the mother. So there is a lot of responsibility and untoward responsibility which gets placed on the mother in the name of glorifying motherhood, which should absolutely stop. Every mother needs to mother at her own pace. You should allow her to relax in the role. Nobody suddenly becomes a mother by just having a child. Mother, I think, is a role that everybody needs to grow into. Your equation with your baby will change as they grow, from needing you to breastfeed them, to needing you to feed them, dress them, help them with their studies, shape them for life. So your role as a mother changes, isn't it? Blaming everything on the mother can put her in a very difficult spot. And why are we discussing this? Because all of that can have a very negative impact on the breastfeeding, and in turn, a negative impact on the health of the child. Then what is role of Ayurveda? A large part of enabling successful breastfeeding and encouraging women to successfully breastfeed goes into Garbhini Paricharya. How do we mentally and physically prepare mothers to have a good, successful breastfeeding experience? During Garbhini Paricharya, a lot of attention gets given to dietetics of the mother in Ayurveda, as well as introduction of herbs, which can help them to have a good nutrition reach the stomach and initiate successful production of stanya as a upadhatu of rasa. Many a times we have seen that there is a thorough confusion in terms of dietetics in the pregnancy. For example, certain doctors tell patients that you are not supposed to ghee, you are not supposed to touch ghee. Even if you have 1 teaspoon of cow's ghee, it will make you gain huge amount of weight, and it will affect your pregnancy health adversely. So as Ayurveda doctors, we need to be able to define correctly as to how much ghee is okay, how much and what kind of milk is okay during pregnancy. For example, most of the Garbhini Paricharya Ahara also involves a lot of dairy product, be it butter, ghee, milk, correct? So from the time of Garbhini Paricharya, if we are able to set standards and standardized Garbhini Paricharya by keeping in mind the traditional practices which get followed in different communities across different regions of India, that will be a very significant contribution to reaching our target of achieving our 69% of exclusively breastfed children and infants. Another thing is mentally preparing mothers in terms of popularizing and encouraging workshops related to breastfeeding, giving them enough confidence that it is possible to breastfeed. What are the things that you need to have? For example, any patient who comes to our clinic for seeking Garbhini Paricharya related advice, one of the advice that we give them are how to make yourself comfortable, not just in terms of what herbs to take or what to do if you don't have sufficient blood supply, how to prevent cracked nipples and all. We also help them understand different things. For example, what kind of pillows to use, what kind of clothes to use, what kind of things will help you breastfeed your baby, what kind of positions will help you, what are they supposed to learn. And these are things that they need to kind of prepare themselves in the 3rd trimester, especially towards the end of the 3rd trimester. Discussion about breastfeeding has to be a part of any kind of Garbhini Paricharya that you are offering your patients. Then in terms of Sutika Paricharya, as I had mentioned before, lot of focus needs to be on the mental well-being of the mother. Stress single-handedly can reduce breast milk supply, and this has been proved in multiple number of surveys and studies that stress single-handedly reduces breast milk supply. It's like you are not having sufficient supply, and you are getting stressed out about it, and that stress in turn is killing your breast milk supply. And remember, one of the master glands for secretion of breast milk, pituitary, sits in your brain. So anything which affects your brain is definitely going to affect the breast milk and the quality of breast milk also. So focusing on mental and emotional well-being as well as physical well-being of the mother is very important. In this Sutika Paricharya, there are a lot of confusion in this regard related to how do we amalgamate our modern knowledge of postpartum care with our traditional practices which have been prevalent in India for thousands of years. So there is a lot of confusion and lot of mixed signals, like the hospital will tell the mother to eat anything she wants. There is no restriction on food, and Ayurveda and traditional practices strictly restrict certain kind of foods. For example, here in Karnataka, only warm water is allowed or hot water is allowed. Water intake is restricted in new mothers. Ginger, pepper, ajwain, and sauf, methi, etc. spices are encouraged. Certain vegetables are strictly prohibited. Certain legumes and lentils are strictly prohibited during the postpartum 45 days period, and so on. These kind of restrictions, there is a thorough confusion, especially in the new mothers of today's generation, whether they are supposed to follow it or not. I think it's the job of Ayurveda practitioners to help them understand why are they important, what impact they have on their postpartum recovery in terms of having a physically fit body. I had mentioned early on into the presentation that pregnancy and childbirth are not diseases. They should not be treated as a disability or as a disease. In fact, we need to empower and encourage women by telling them that if you are able to take care of your health in a very scientific way with Ayurveda, by understanding your traditional practices, then you will definitely sail through your pregnancy and postpartum period. The decline in physical and mental energy is bound to happen initial few days of your pregnancy, and that is the reason why there is a strict Sutika period which gets followed in Ayurveda to help a mother have that transition in a smooth way. Both ends of the spectrum are not good. One which says that, oh, you are perpetually a Sutika, you need to not step out of the house, you are not supposed to exercise even beyond 45 days, gain so much of weight, lose your muscle mass, become very fatigued and weak both physically and emotionally. This is what we see in many of the girls. Or the other extreme, in which third day into the delivery, the third day into the postpartum period, you have resumed your food intake routine and your socializations and everything, and you are all over the social media getting exposure of all the things which are unnecessary during that period. So both ends of the spectrum are not good. Then it's the job of the Ayurveda doctors here, I feel, who can understand what impact such period following observing a Sutika period has on the body and mind of the mother as well as of that of the child. Then concept of Dhatri. Dhatri concept is unique in Ayurveda for the fact that it gives us alternates of breastfeeding if a mother is not able to supply. Now, if the mother is able to supply breast milk and feed breast milk successfully, great. Otherwise, concept of Dhatri can evolve in many different ways. For example, there are companies nowadays which provide pasteurized and processed breast milk for babies who are in extreme need of it. For example, extremely premature babies, babies who need it for, for lactational failure and so on. I don't think commercial usage of pasteurized breast milk is very common yet, but it is there for babies who are in NICUs and premature babies, etc. For example, there is a company called Neolecta, which is into manufacturing of pasteurized breast milk and which does adhere to a lot of principles of Ayurveda in terms of helping their donors understand principles of Ayurveda well. They have Ayurveda specialist on board to encourage the concepts of Stanya in Ayurveda, which are very unique to Ayurveda, be more applicable scientifically and more available to society. So do remember that concept of Dhatri is evolving. And in terms of a mother also who wants to feed the baby while she's working, certain things such as pumping of breast milk, safe storage of breast milk, which are concepts which are very popular in the developed countries, also need to be gradually introduced to India and made popular and more accessible to people. Of course, the reason why government had not promoted it is because of the risk of sanitization and sterilization, which is associated with these practices of pumping and storage of breast milk. But yes, these are concepts which will definitely evolve and be more relevant in the near future. And then ensuring Shuddha Sanya, as I said, many of the factors related to emotional well-being of the mother have direct impact on Shuddha Sanya and also dietetic factors. So during the Sutika period and during the period that a mother breastfeeds, Ayurveda doctors can help them understand what are the foods which encourage formation of breast milk, which has a balance, which can promote health in the babies and also promote balance in the mother's body and encourage her to be healthier as well. It shouldn't so happen that in the pursuit of breastfeeding her baby, the mother completely loses her vitality, which does happen. For example, the calcium and the iron which goes from the breast milk to the baby is taken from the mother's body. So unless the mother takes a good diet and a well-rounded balanced diet, not only is she losing her own vitality to the baby, she will also progressively become weaker and weaker, which is why we see increased hair loss, lack of skin health, weight gain in postpartum mothers, and so on. Then promoting and encouraging traditional practices is another area which is very important for today's discussion. Many of the traditional practices focus on encouraging women to be physically extremely healthy and strong by the end of the 45 days rest period. Because in the olden era, permanent rest was not available for women. Although they didn't go out and work, they still were contributing members to their family in terms of working in the house, farms, fields, etc. So most of the postnatal care practices focus on building adequate muscle strength, building adequate dosha balance in the body to encourage a woman's body to return to its pre-pregnancy health phase. So a revival of these practices is a true need of the hours, because as we are losing our octogenarian, our ancestors or our elders in their 80s and late 70s, and they are in their 90s, we are losing precious knowledge of traditional postpartum practices, which are so unique to every community in every region of India. So this is a national treasure which is vanishing. And failure to revive these practices will leave a considerable dent in the health profile of our future generations. Then adapting the traditional practices to present day circumstances. For example, if I take example of Bangalore, Bangalore used to be a very, very, very cool place with temperatures which are definitely unreal for other places in India, especially towards the south. These temperatures, since with the changing environment, have increased. The temperatures have increased. So certain practices such as restricting water intake in the postpartum woman are not applicable now so much as they used to apply before. Also, some practices need fine-tuning depending on the prakriti of the mother who is giving birth and her age. So some things need to be adapted to the present day circumstance. Also empowering mothers with Ayurveda and giving them that confidence that there is no need to have any anxiety about doing something wrong to your baby while you are breastfeeding. And definitely, whatever you are doing is helping your child, and you need not be held guilty or you need not be accused for something that you're doing with good intentions to your baby. So I think the kind of like treatment that Ayurveda doctors tend to give to their patients, this is something which we can definitely achieve. And then self-care with Ayurveda, teaching women how to take care of their self in terms of diet, lifestyle, yoga, and Ayurveda supplements postpartum can help to encourage the breastfeeding to continue for a very long time in women by making them very confident about breastfeeding. So thank you so much for giving me this opportunity. I thank the Department of Kaumar Vritya and especially Dr. Sarita for having invited me for this extremely appreciable and good initiative of celebrating the breastfeeding week with much needed discussions. I hope as the audience today, you will definitely take away things that you can apply in your practice related to support and encouragement of mothers who are breastfeeding. One last topic that needs to be discussed today is how can scholars of Ayurveda as well as practitioners of Ayurveda can pursue a career as lactational consultants. Lactational consultants are special consultants who have certificate or diploma courses who take special training to understand techniques of lactation, techniques of supporting women who are breastfeeding, new mothers, or later on into their postpartum period also. And they are certified and attached with the lactational boards. So this is a great career that Ayurveda students should consider as a way of making a successful career into. I would highly recommend and encourage it, so that our knowledge related to lactation and breastfeeding and Stanya in Ayurveda can reach the masses and can reach the society and definitely benefit everybody and many, many future generations from it. So thank you one and all. Thank you for your patient listening.
Thank you, ma'am, for sharing your knowledge with us. Now the session is open for discussion. If anyone is having queries, they can ask in the chat, but they can put the messages in the chat box. So it will be easy for the ma'am to answer all the questions. Okay, so now two questions are there. First question is, many a times ladies are addicted to smoking or alcohol. How this affects the breast milk secretion and how to manage these kind of cases?
So what I would like to say here is that forget about breastfeeding and lactation during pregnancy.
Ma'am, can you hear me?
Yes, I can. Are you able to hear me? Hello? Am I audible?
Yes.
Am I audible?
Yes.
Yes, ma'am, you're audible. Yes, ma'am, you're audible.
I think I'm audible now, right?
Yes, ma'am.
Yes.
Okay, thank you. So the risk related to smoking and alcohol intake during pregnancy itself is so high, right? So the discouragement for smoking and alcohol needs to start even 3 months prior to the time that they conceive. Now, related to alcohol, there are two sides of it. Some types of alcohol are allowed or are even recommended as Sanya Janana in Ayurveda. But pathological or addictive intake of alcohol is definitely not to be allowed during postpartum period. It will not only affect the mother's health, or it will also affect the baby. It may not bring down breast milk supply per se, but it will definitely affect the health of the child in terms of liver functions of the baby, and emotional and mental well-being and brain health of the baby will get affected. Smoking is an issue which I think it's a cancer which is affecting our society, especially in the younger generations, wherein it is seen to be something which is very cool to do, right? There is a lot of peer pressure that I have seen in younger women to smoke and to drink, and they will not get accepted into their peer groups. So this kind of very primitive behavior needs to be discouraged even before they conceive. So, and during the postpartum period, it may not affect the supply of breast milk, but it will definitely affect it qualitatively. And passive smoking in newborns, that is the smoke, which can be inhaled by the newborns, will increase the risk of respiratory conditions such as childhood asthma and so on in the newborns, and even risk of cancer. So needs to be strictly avoided. Any other questions?
Thank you, ma'am. Now the next question is, during Sutika period or just after 3 to 4 days of delivery of baby, many patients are indulged in sexual activities. Does this affect the breast milk secretion, and should abstinence for strictly maintained?
Abstinence needs to be strictly maintained due to the mode of delivery, right? Because the uterus is still recovering, and the postpartum, whatever local discharge will come out is still continuing. And in terms of cesarean section delivery, it is strictly prohibited to encourage healing of the sutures. Whether it will affect the breast milk supply, probably not, because oxytocin, which is one of the major hormones which gets secreted during the sexual activity, will keep the breast milk supply going. So in terms of supply, it will not affect, but in terms of the maternal health, it will have a lot of adverse effects on her recovery, and with her risk of developing different kind of pelvic, picking up pelvic inflammations and infections, right? The risk of infection can increase largely. So in terms of maternal health and postpartum recovery, there is a larger risk. Risk in terms of breastfeeding may not be there. Any other questions?
Any questions? Any more questions to ask? Any queries are there? Please put the message in the chat box. Thank you, ma'am, for giving your valuable time to us. Thanksgiving is a time of togetherness and gratitude. Ma'am has explained about the importance of breast milk for mother and baby, giving in detail. Thank you so much, ma'am, giving your valuable time and knowledge with us. Now we will wind up the session, first half of the session. Now we will come to a lunch break. At 2 o'clock, we will meet up again with another half session. Thank you.
Thank you so much.